Hi, my name is Billy Partita. Doctor has ordered for a lab draw for the patient today. So I knock on the door. I wash my hand. I check the chart. No allergies to the patient. Provide privacy. Good afternoon. My name is Billy Partita. The doctor has ordered lab draw for you today. Can you verify your name and date of birth? And the patient says Jennifer Doe, date of birth 11/5/1975. So we're gonna take blood from your central line. So no poke today. Do you have any questions?
No.
Okay. So I have gathered all my supplies. I made sure that there is no it's not expired. Everything is current. I have three 10 ml liters of saline flush, and then I have one empty. To draw the blood, I have the vacuum container for access and the vial for the blood that we will send down to the lab. Alright, so I'm going to wash my hands, put on my clean gloves. I'm going to stop the IV, any IV the patient has, for 2 minutes until we draw the blood, and then we will turn it back on after we have drawn the blood for you. Okay? So I look at the site of the central line. Everything looks good. No, doesn't look like there's any infiltration or phlebitis or infection for the patient. So I'm going to clean off the port. You want to clean it for 15 to 20 seconds. As I stated, we're going to use saline flush today, but you would check protocol and see if you need to do heparin flush for the patient for this procedure in your facility. I'm going to unclamp the lumen tube. So first I'm going to flush in ten milliliters of saline. And I'm going to draw back 10 milliliters of blood to waste. So this will go into the sharp container as waste. I then am going to clean off the port again for 15 to 20 seconds or per protocol in your facility. Then I will withdraw the blood that is needed. The order says 6 milliliters of blood, so on the tube, so I'm going to take 6 milliliters only. Attach the vacuum container to the saline, where the blood is, the syringe, and then I'm going to put the blood into the container. Okay, so this, I'm going to shake it. This will go into the sharps container. I'm going to label this. We will send it down to the lab, verify it with the patient, write patient name, date of birth, everything's good. Send this down to the lab. Then I'm going to clean the port again for 15 to 20 seconds. Going to pulsate in 10 milliliters of saline flush. Okay, put this in the sharps container. pulsate for the last time another 10 milliliters of saline flush and washing this for 15 to 20 seconds or per protocol in your facility. And the reason you want to pulsate it in and use the 20 milliliters is so that the medication goes in to the patient. I'm going to do one last clean just to make sure it's clean, 15 to 20 seconds. Clamp this. Ask the patient if how they feel. They say they're feeling okay. I'm going to go and document what I did, throw away my supplies, take off my gloves, provide safety and comfort to the patient. And that's it.